Hello everyone, welcome to employee training on the Emergency Temporary Policy and Procedure on Infectious Disease Prevention. My name is Candy Hensley. I am an assistant to the county administrator. I will be narrating this training. The first question you probably have is, why are we doing this? Virginia's Governor Northam appointed the Department of Labor and Industry, or DOLI, to formulate requirements that would protect employees from SARS virus that causes COVID-19. DOLI's regulation became effective on July 27, 2020. It can be found under Virginia Code 16 VAC 25-220. These regulations apply to all employers and places of employment in Virginia within Virginia's Occupational Safety and Health Program. If an employer does not implement and enforce the requirements, statutory penalties can result. As can be seen from the slide, they can result from approximately $12,000 to $130,000 depending on the seriousness and if it's a repeated violation. The regulation is enforced by the Virginia Department of Health. You can find Augusta County's policy and procedure on the shared M drive. If you are outside the government center, it will be on an applicable drive for your department. If you have problems finding the policy and procedure, please contact me or the Human Resources Department. You will be looking for policy and procedure number 61. All county employees must follow this policy and procedure. You must first certify that you have received training. After you have completed training, please get with your department head or supervisor to sign the form indicating so. Completed forms must be returned to the Human Resources Department to be maintained. It is very important for me to note that the Center for Disease Control guidelines change often. I encourage everyone to visit their website to obtain the latest information. There are links included in the policy and procedure. So, what is the state requiring us to do? There are four main objectives listed. The first one is to determine the level of risk for employees. You will see written in the policy that employees have been listed per position types. The assessment will include what your hazards are and what precautions need to be taken. You will see that the majority of the precautions are for PPE and social distancing. Next is implementing self-monitoring guidelines. We will discuss the symptoms of COVID. It is up to the employees to self-monitor and not come to work if they are sick. If you think you have COVID, we encourage testing, but we cannot mandate testing. The standard requires us to implement procedures and controls. You are already familiar with the controls listed on the slide, including barriers, workplace practices, social distancing, PPE, and sanitation practices. They are all very important. There are many symptoms for COVID. You can be sick and it not be COVID. Unfortunately, we have to assume it's a possibility when you are sick. The most important thing I can tell you is stay home if you're sick. No one wants what you have, whether it's COVID or not. If you're homesick, be sure to call out per county policies and procedures. That is normally done by contacting your supervisor. The common symptoms are shown in the diagram, and they're not related to any underlying medical conditions. It's fever of 100.4 or more, cough, shortness of breath, chills, muscle aches, vomiting or diarrhea, and a new loss of smell or taste. This chart from the Virginia Department of Health indicates the differences between COVID and other illnesses. It may be helpful in determining if your sickness is potentially COVID. It shows different types of illnesses, the onset of symptoms being gradual to abrupt along with the symptoms. As you can see on the chart, it shows the comparisons for seasonal allergies, cold, strep throat, flu, and COVID-19. One other thing to keep in mind is your risk for severe illness. Your risk of getting COVID or it having a negative impact is higher if you have an underlying medical condition. There are many listed on the CDC's website. This slide lists several. They include cancer, chronic kidney disease, COPD or other pulmonary diseases, immune-compromised systems, obesity, serious heart conditions, sickle cell disease, and diabetes. You may hear that someone has had an antibody test. Antibody tests can determine if the virus was present in the body system, whether you were symptomatic or not. Because you test positive for antibodies does not mean that you can pass the virus to another person. Even though you may have tested positive, you can report to work and follow the protocols contained in the policy and procedures. So how does a virus spread? It is thought to spread from person to person through respiratory droplets. Droplets are produced by someone coughing, sneezing, or talking. Someone else picks up the virus through their nose, mouth, or eyes. That is why it's important to take precautions. It will slow the spread. It is important to note that you may have been in contact with someone with COVID before they even showed symptoms. When contact tracing occurs to determine who was exposed, they look back 2 days before the onset of symptoms. Also, you can be exposed by an asymptomatic person and not even know it. So take precautions and monitor health and symptoms at all times. All employees have heard what they need to do in order to remain safe. I'll review social distancing, face coverings, cleaning, and disinfecting shortly. Listed on the slide is to wash hands frequently and use hand sanitizer. All departments have been given hand sanitizer and it is located in the public hallways. It is there to be used. Also, do not shake people's hands or touch people. Practice non-contact greetings. Social distancing is the most important precaution to take. It is your first line of defense. In work settings, ensure you are social distancing in open office conditions, meetings, or when having conversations. When and where social distancing can occur, engineering controls such as barriers need to be in place and/or PPE must be worn. Remember, social distancing is 6 feet or more. Face coverings are on everyone's minds. There are many options out there. The county is following CDC guidelines and state mandates. The CDC has developed the poster at right to show how masks should be handled. I stress to you to review CDC's website should you have any questions about the mask you wish to wear. The CDC recommends 2 layers of fabric and the mask needs to fit to your face without gaps. Cloth homemade masks are fine. The only mask the CDC does not recommend are the ones with valves. There are other cautionary masks and shields. Studies are being conducted. You should be aware that recommendations change and we will need to change with them. As far as policy on wearing masks, employees need to wear them in public places in the building, such as hallways, bathrooms, and meeting rooms. They must be worn where social distancing of 6 feet or more cannot be achieved in all cases. If you are in an office that is open or has cubicles and you cannot meet social distancing requirements, you need to wear a mask. If you are in these types of environments, you're encouraged to work with your supervisor to move desks so that you can meet the social distancing requirements, or you can consider installing barriers. We can help with that. Please contact me or our facilities team. Remember, masks are to protect others, not the wearer. It keeps your droplets from being spread. Cleaning and disinfecting is important. The CDC does have recommended steps you can see on the slide. Disinfecting does not necessarily take care of cleaning and vice versa. It is important to be sure the chemical you use will kill COVID. Some disinfectants need to remain on the surfaces before wiping them off to give time to kill the germs. Be sure to read the labels and follow directions. All public areas are cleaned by the facility team. All department areas, including offices, conference rooms, and break rooms, need to be cleaned by interdepartment staff. Cleaning and disinfecting should be completed at a minimum of once a day. It includes frequently touched surfaces such as tables, doorknobs, light switches, phones, bathrooms, etc. If you have questions about cleaning, please let us know. One other important item to touch on is shared equipment, including pens and pencils and electronics. If you are in an area that's being shared by others, especially the public, they should be disinfected after each use. DOLI requires the employer to let you know about anti-discrimination. No person shall discriminate in any way against an employee because the employee has exercised their rights under the safety and health provisions of the Code of Virginia. No person shall in any way discriminate against an employee who voluntarily provides and wears their own personal PPE, including but not limited to a respirator, face mask, face shield, or gloves, provided that the PPE does not create a greater hazard to the employee or create a serious hazard for other employees. No person shall discharge or in any other way discriminate against an employee who raises reasonable concern about infection control related to SARS virus and COVID-19 to the county, the county's agent, or other employees, or the public. I have mentioned that an employee exposure assessment is required by the standard. The complete assessment is found in the County Policy and Procedure number 61 in Appendix A. Everyone should take a look at the assessment and follow the guidelines. When reviewing the assessment, you will notice that positions are not listed per job title, but are listed as a job type. When determining the job risk level, several factors are considered. Job tasks being performed, the duration and frequency of exposure to an individual, working distance between people, and the presence of a known or suspected COVID-19 person. There are 4 levels of employee risk. All employees fall into one of these levels. The very high risk level involves aerosol generating procedures, collecting and handling specimens, post-mortem procedures, specific medical and laboratory settings. This includes jobs related to first responders. It includes fire and rescue and sheriff's office personnel. The high-risk category involves other individuals that provide health care or work within 6 feet of a known or suspected infected persons. Included in this area are animal control officers. The next category is medium risk. This involves jobs involving minimal occupational contact with others within 6 feet. Employees included in this category are maintenance staff, custodial staff, some parks and recreation staff, inspectors, library employees, and those who are required to go into the field. The lower risk category are those who have minimal contact with other employees or the public, or achieve minimal contact through engineering controls such as barriers. Employees in this area include office-type positions and those who are not required to go into the field. This standard requires an employee's assessed as very high or high must complete additional infectious disease preparedness and response training. Currently, the agencies that are required to complete this type of training are fire and rescue, sheriff's office personnel, and animal control. These agencies are addressing this requirement directly. This is an important slide. If you have COVID, obviously you're at home isolating. So what do you do, or what happens when you have someone close to you who is suspected, clinically diagnosed, or has tested positive for COVID? If an employee has had close contact less than 6 feet for a duration of 15 minutes or longer, then the employee who has been in contact with the individual will quarantine at home. Quarantine time will be 10 days after the last exposure date. The individual will further self-monitor for symptoms. If an employee has not encountered an individual suspected, diagnosed, or tested positive, the individual may continue to work at the place of employment after proper disinfection. Should the suspected positive employee receive a negative test result, then the employee in contact may return to work. The employee who is sick shall follow Augusta County policies and procedures. Exposure is measured 2 days previous to the onset of symptoms. For example, Susie became sick with symptoms beginning at work on August 18th. An individual in contact with Susie beginning on August 16th will be considered as potentially exposed. Employees that have been isolated due to a known positive or suspected positive COVID diagnosis of a member within their household may return to work when it is safe to do so according to CDC guidelines and their healthcare provider. Normally, the person will be quarantining with the person isolating. As long as the person does not develop symptoms, they can return to work after 10 days. You have all heard about contact tracing. Always keep note of who you have been in contact with longer than 15 minutes and within 6 feet distance. We hope it never happens, but if you're diagnosed with COVID, we will need to determine who you may have exposed, including 2 days prior to the onset of symptoms. Notifications are required to occur within 24 hours after discovery of exposure. If you have been exposed, either your supervisor, administration, or human resources will notify you. You may be contacted by the Virginia Department of Health as well. If you are contacted, you need to monitor your symptoms very close. You also may be quarantining depending upon circumstances. You will not be told the person's name under HIPAA or other rules. So, if you had COVID when you come back to work, it's 10 days after your symptoms first appeared. You must have had no fever, without fever-reducing medications for at least 24 hours. Your symptoms must have improved. Depending on the severity of the virus, you may need a doctor's release as well. If you tested positive but never had symptoms, it will be 10 days after quarantine. There are a few other items that we need to touch base on. One is break rooms, meeting rooms, conference rooms, dormitories, and bunk rooms. Administration is encouraging that meetings continue to be conducted by telephone, Zoom, or other means as feasible. If you have person-to-person meetings, please social distance. If you cannot social distance, you must wear a mask. Employees need to maintain social distancing while in break rooms, meeting rooms, and so forth. As a reminder, masks are provided to the public and they are available to staff. If you are planning to travel outside the state or country, please talk to your supervisor. If there are state or national restrictions, it could affect your return to work. Travel and potential quarantine will be handled on a case-by-case basis. Please have the conversation so there are no surprises when you return to work from vacation. The state has mandated that you must wear a mask when 2 or more are occupying a vehicle. Supervisors can consider allowing travel in multiple vehicles, but budgetary ramifications must be considered. It is highly recommended that vehicles are disinfected at the end of each day or shift. Also, if vehicles are used by multiple people, they need to be disinfected between people. Hand sanitizer is available for each vehicle. If you do not have any, please contact facilities maintenance. We are required to communicate with contractors, vendors, and/or subcontractors that we come in contact with. They are to notify the county if they have someone that has COVID, and we are required to notify them if they are exposed to one of our employees with COVID. As part of the procurement process, contractors will be required to complete the form contained in the Policy and Procedure number 61. It is in Appendix B. Those of you that work with outside folks need to be aware of this requirement. Previously, you were notified of the county's telework policy related to COVID. It is also included in the County Policy and Procedure number 61. If you happen to be quarantined or isolated and you are able to work, you may be eligible to telework. Also, there is sick leave available under the Federal CARES Act, or FCRA. You are encouraged to contact Human Resources for more information and to determine how it is applicable to you. This is the last slide. I appreciate your attention to this training. I apologize for the length, but the contents are important and are required. I hope you gain knowledge on COVID and have a reference to fall back on. To drive home training and recap what we discussed, it is very important to do your part. Wear face masks, social distance, wash your hands. Wear other PPE that's required. Clean and disinfect surfaces often. Monitor yourself for symptoms. Don't come to work if you're sick. Keep abreast of CDC guidelines. They change frequently. There is paid sick leave available under County Policy number 7. Employees may be eligible to telework under Policy number 7A. Please remember to get your supervisor to certify that you've completed training. I hope you have a great day and thank you.